Good morning, now time for your weekly Kasuth Regional Health Center report. I'm Mike Vandy. I'm joined this time around with Mia Hegarty-Roach. Mia, thank you so much for joining us here on the program this morning. For those that may not know, what is your role with the Kasuth Regional Health Center?
I'm the clinical psychologist here.
And we have you on the program because we are talking about seasonal affective disorder. What are some common symptoms of seasonal affective disorder?
Seasonal affective disorder is a form of depression. It is sometimes called winter depression, and you often see mood changes like depression that happens other times of the year, but it tends to occur more in the fall or the winter when the sunlight is less and improve more in the spring. And some symptoms can be mild to severe, where you feel sad or depressed more days than not, tired all the time, even if you sleep a good amount, even if you sleep too much. People tend to be kind of worn down. Weight gain and overeating with carbohydrate craving, and a loss of interest or pleasure in things that you usually like to do. So those are some of the symptoms. It can also be things like restlessness or trouble concentrating or trouble making decisions. And at the more severe end, even feeling worthless or having thoughts of suicide or death.
Now, when you look at this disorder, what sets this disorder apart from the winter blahs, if you will?
Mm-hmm. Yeah, a lot of people get the blahs because we aren't just able to go out, especially here in the Midwest where temperatures are cold and weather's unpredictable and we don't have as much sunlight. However, it's different in that the severity of symptoms are very distressing and sometimes overwhelming and really interferes with your ability to function daily, whereas the winter blahs are just something you sort of feel and can get through.
Now, what are some common causes of this disorder?
Well, it's thought to be related to, and it's not known with 100% certainty, but thought to be linked to biochemical factors in your brain that's prompted by the shorter daylight hours and less sunlight. And that's evidenced by it's more common in people who live further from the equator who get less daylight hours in the winter.
Now, as we continue on, you're listening to your Kasuth Regional Health Center report. I'm Mike Vandy again with Dr. Mia Hegarty-Roach. We are talking here about seasonal affective disorder on the program. Let's continue with this talk here. What sort of strategies do people use to deal with this disorder?
Well, there's a lot of different ways we can work on treatment options for folks. And of course, the first step would be seeking medical help for proper diagnosis and to rule out other medical conditions that might be causing symptoms. But once a diagnosis is made, then we have lots of things, including light therapy, medications, or talk therapy, or usually some combination of those things. And treatment usually improves symptoms. People have good results. You know, there are some other things that you can do on your own at home, including increasing your time in the sunlight by going outside when the weather's okay, or being near windows. Also, regular exercise, healthy eating, and a regular sleep schedule can improve things a lot, as well as staying active and being socially connected and doing things with others can help those symptoms quite a bit too.
Now, if people are looking for more information about this disorder, maybe they need some treatment as well, what's a good way for them to get a hold of somebody?
Well, of course, they can call us out here at Kasuth Regional Health Center. We'd be happy to see them, either make an appointment with their general physician, or they can certainly make an appointment with me at our same front desk helpful staff, or with our same helpful staff. Also, if their symptoms are severe, especially if they're noticing suicidal thinking, of course, you should consult your doctor immediately or seek help at your closest emergency room.
Mia, thank you so much for joining us here on the program.
Thank you so much.
This has been your weekly Kasuth Regional Health Center report. You can hear a new report every Thursday in the 9 o'clock hour, about 9:05, and then you hear the repeat. That's right, there's two shows. You can hear the repeat of the show on Tuesday, same time frame, about 9:05, right here on Hometown Radio, KLGA.